And when you have conversations with people, especially insurers, they're going to use some kind of guideline. So if you come to the table and promote the guideline that chiropractors have been working diligently on, then hopefully that puts you in a better situation moving forward.
Hey, Smart Chiropractors. Welcome to today's Smart Chiropractor Show and our featured guest segment. I'm Dr. Jeff Langmaid, and I have the opportunity to sit down today and chat with somebody I met many moons ago, and I'm happy to reconnect with. That is Dr. Kris Anderson. Kris, thank you so much for taking some time and chatting today.
Well, it's my pleasure to be here, Jeff. I appreciate being able to talk with you and love what you're doing with the Smart Chiropractor. So glad to be able to contribute.
It is our pleasure. I know you as somebody who is a fantastic clinical doc. You also have been involved politically. You have been involved on the research front. You got a lot of stuff going on, but I would love to trace it back before we get there and talk a little bit about how you became interested in chiropractic. If I remember correctly, I believe your father is a medical doctor, if I'm not mistaken. I'd love to know your journey to becoming a chiropractor. I think that'd be fascinating.
Yeah, absolutely. So my dad is a family medicine internist. Now, he's not a medical doctor. He's an osteopath. So growing up in an osteopath household in Kirksville, Missouri, which was the birthplace of osteopathy, my first experience with any kind of manual therapy or manipulation or OMM, OMT, whatever you want to call it, was when I was first born. So not that different than many chiropractic stories that you hear from people who grew up as chiro kids. I was born was a forceps baby back when they did more of that still. And my dad was just finishing up his education. And so my parents took me in to see his OMT professor at the college. And that's how my journey started, I guess, down this path. So growing up, we used to get what we called treatments at home from dad. And he'd pull out the big adjusting table that we had at home tucked away in the closet. And that's how we took care of most of our aches and pains. And especially as I got older and got more involved in sports, that's exactly what I relied on to keep me on the field feeling well and moving well. And I took that interest into college, and I was interested in exercise science, and that's what I was studying, but I didn't know what I wanted to do with that. And as I was looking through some materials, I found that I could transfer some of my program credits to chiropractic school. So that was one of the first times I thought about connecting my path in education and exercise science on to becoming a chiropractor. And, my dad was pushing me maybe to consider going osteopath school, but there were just a lot of things I didn't want to learn there. And I didn't want to take call. I grew up getting the phone calls late at night and at odd hours when he was still taking call. And there's just certain elements of that I didn't really want, and a lot of things that made sense by becoming a chiropractor. So I went to chiropractic school and have loved it ever since. There's a lot of challenges, but at the end of the day, I have more control over my practice and what I want to do and how I want to take care of patients than I would have if I chose any other path, and I love it.
Hey, Doc, do you have an email list of 300, 500, or more? If so, please connect with our team at thesmartchiropractor.com. With Patient Pilot, we can activate that email list and start generating reactivations into your practice each and every week. To schedule a demo and learn more, head over to thesmartchiropractor.com. Again, that is thesmartchiropractor.com. But right now, we'll head back over into this awesome interview on Interviews by the Smart Chiropractor. That's fantastic. I know one of your passions is also involved with the North Dakota Chiropractic Association. And I'm curious, was that something that stemmed in chiropractic school and started? Were you not as engaged and involved and then got super involved once you got up into North Dakota? I love the story of how you made that decision between DC or DO. But there was another decision, and probably many more that we're going to dive into, but whether to become involved. And there's so many chiropractors that are either hesitant or don't become involved in their state organization and national organization for that matter. In your case, you're somebody that chose to do that. Where did that start from? And what were maybe some of the benefits that you've seen by being so involved?
When I finished my chiropractic degree program at Palmer, that was back in 2007, and I immediately went into a research fellowship. And I spent 2 years studying under some of the best chiropractic researchers the profession has to offer. And in that process, I learned a lot about the politics of research, which, if you aren't familiar with, it's the only place where you can find more politics than politics itself. So once I finished that program, I had a master's education in clinical research, but I also understood that there are a lot of moving pieces behind the scenes that were really important for people to take part in. And that's when I moved to North Dakota and started practice here with my wife. It became very clear that we needed people who had the type of education I had in not just research, but the understanding of the political side of things. That when it came to meeting with payers or going to, Capitol Hill, the state capitol, speaking to other agencies and other stakeholders, having a basic understanding of the research evidence is critical. That's the coin of the realm. But once you understand that, then if you know there's some political wheeling and dealing behind the scenes and you're there to solve other people's problems, pretty quickly you're able to make some connections that can move a lot of effort forward. And what's really nice about our profession is that, especially in the during the opioids epidemic, we came to the table with solutions, and we weren't asking for much. People were asking what we could bring to the table to help solve that problem, or at least contribute to the solution. And that's where we had a lot of success. I say we because as I became involved in our state association, we worked together very closely with several on our board, and we tried to brainstorm the best way forward so that people in our state at least could have better access to what we do, and that the chiropractors in our state could be treated fairly. And we think we have one of the best states there is to be a chiropractor.
Couldn't agree more. I talk with docs quite often, and we talk about states. I actually always bring up North Dakota as I don't want to blow it up right now and say, oh, go to North Dakota. You guys are very happy with the current situation that you have. Maybe talk a little bit about that. I know there are some states out there that are just so challenging to practice in, whether it's from a reimbursement front, whether it's from a what you can and can't do. There are just so many challenges. Some states, it's as if it's almost impossible to get a business started. It seems as though North Dakota is super friendly to chiropractors. Clearly, the work that you've done has contributed to that. But could you dive deeper a little bit into what the landscape of chiropractic is in North Dakota and why it's probably one of the gems in the country as far as practice is concerned?
We have Midwest sensibilities, which means when we have a problem, we try and get a hold of both sides of the issue and try to sit down and have a conversation about it. Now, that isn't the approach for everyone. We're fortunate in a lot of ways because we have an insurance market that's fairly well managed. We have a reimbursement system that it actually is the number one in the country per capita. You get paid better in North Dakota than you do anywhere else. And we have nothing to do with that. That's across the board for healthcare. So we're fortunate enough to be in an environment that if we treat people fairly, we get treated fairly. And in a lot of ways, I take that message to other states because when they sit down with policymakers, if you force people into a game for their own survival, then they will play that game. And that's how you end up with care plans that may not align with the best evidence. But at the end of the day, if you can't keep your doors open, it's really hard to deliver evidence-based care. So it's a two-sided equation. You have to have a good market, and I think we do. And then you also have to have people who are willing to treat people fairly, like I said, and do good work. And we definitely have that. And we welcome any chiropractor who wants to come to North Dakota. You have to stay year round though, and we don't have a lot of people willing to do that in the wintertime. But what's also nice about that is we've seen this play out. A couple of years ago, the best example I give is that we had a policy that more and more states are going to see. I think I just heard about it a couple of weeks ago here, or last week, about chiropractic services with infants. And our Blues plan implemented a policy that removed that as a benefit. And we went to the table with them and asked them to reconsider. And one of the reasons that they reconsidered, and we were able to introduce an evidence-based structure for them to adopt for their care coordination. But when they reviewed the episodes of care for that patient population, the average episode was 4 visits. So it was a solution in search of a problem. And as soon as we were able to demonstrate that, they removed that and were able to practice the way we'd like to. So there's two sides of things. And there are lots of states that do not enjoy the same environment that we do, and I fully respect that. But at the same time, we still work really hard to make sure that we have really strong relationships with the decision makers in our state, whether it's health plans, whether it's our insurance commissioner's office, whether it's our health and human services um, executive director, whether it's the workforce safety and insurance executives. And I mentioned all those folks because in the last, I think, 8 weeks, we've met with them all. And then that's without mentioning that we were out in Washington, D.C. meeting with our representatives there too. So it's a very active process. But if you're able to sit down and have conversations, then over time, you're likely going to be able to influence those folks in a positive way. Because, like I said, we come to the table with a really positive message, and we have a lot of solutions when it comes to evidence-based care for cost-effective care, high-value care. So over time, as you work to educate folks, things start to change in your favor, and that's what we've done.
I think you've done it exceptionally well. And one of the things I've noticed in North Dakota in that landscape, there just seems to be that interconnectedness. And I don't think that happens on accident. It takes that active role that yourself, amongst a host of other chiropractors, have really taken. I love it. And I'd love to talk a little bit more about that interconnectedness, because I know you've practiced in what I'll call a traditional chiropractic private practice, as well as in a community health center. And I'd love for you to tell the listeners and explain a little bit more, maybe that are unfamiliar with what a community health center is, what that is, and maybe highlight a few of the benefits that you've seen practicing in that environment as well.
So the community health center is something that I'm really passionate about, and it actually came to fruition because I sat at the table in one of our association meetings. We went to the table asking for a chance to participate in a grant that was going to educate providers across the state and our region and CMS about non-pharmacological treatments for pain. And as we sat with the grant team at our university here locally, we happened to be talking before the meeting, and the medical director for our community health center said, well, we should have a chiropractor in our health center. And I said, yeah, you should. And she said, well, maybe we'll hire you. And I said, well, you should. And that's essentially how I got hired. That process took many, many months after that meeting to finalize a way for me to work part-time. And that started in coming up on 4 years ago now. It was 2018, fall of 2018. I started working for 4 hours a week in their satellite clinic, which conveniently is located in a small town a little bit closer to where I live out in the country. So I spent 4 hours a week there, and I spent the rest of my week in town at my main private practice, where I might work with my wife. Now, they have a main campus in town as well, and eventually they were able to develop more space through some of the grants that they received. And I'm giving this long, drawn-out explanation so people understand that these are things that just don't happen overnight. They had a grant from HRSA, which is federal money, to build out a service line for optometry. And by developing a capital project with that HRSA money, they carved out more space for me in an area they weren't using on the medical floor. So they asked if I wanted to be in the brand new area where the optometrist would be, and we would share some space, and it'd be maybe across the hall from behavioral health on the second floor, or I could be up in the corner on the third floor with the rest of the medical clinic. And I chose the medical clinic because I wanted to practice integrated care. And that's what we do now. So starting last fall, I was able to work now. I split my time. I spend 20 hours a week for the health center, and I'm still out at the satellite clinic, but only 2 hours a week. And now the rest of the time I spend downtown. Now, our health center it's a federally supported program, which means everyone gets care, even if they can't pay. Our health center is located next to our mission, which isn't by accident either. So I see a lot of people who suffer from housing and other, food insecurities. They may be living on the mission or on the street, and they're in for a host of different reasons. And one of the ways that we help improve their life is that we offer chiropractic services. So you can imagine those patients aren't coming to my private practice. They don't have any insurance. They can't get here. There's just a whole host of reasons why they're just not well suited for coming to a private practice chiropractic clinic. But there's a lot of really great benefits of having them come to see me as part of their treatment plan in the health center. It's like I said, an integrated health care delivery model, and we have primary care, we have behavioral health services, we have addiction counseling and social services, just all the different things that if you were building your team, you would want those people on your team to deliver great care. And that's what's so great about being part of a community health center. Now, the other benefit is that because chiropractors, and this gets a little into the weeds, but because we're able to bill for evaluation and management services, those E&M codes trigger basically a facility fee that the health center benefits from. It helps supplement the visits that patients have who don't have any care at all or don't have any coverage at all. And that facility fee helps support all the services that are delivered there at the health center. So by being integrated, we're able to not only see patients who would never see the chiropractor otherwise, but we're also able to then benefit the health center by offering non-prescriptive services, which they otherwise wouldn't have access to typically. So it's a great setting. There's a lot of other benefits to being a chiropractor there. And at this point, what we're trying to do is just build out that model for delivering chiropractic services in a community health center in North Dakota, so that hopefully the other 26 health centers in North Dakota can have a chiropractor on staff full time. So I don't know that I'll ever be the full-time chiropractor at our health center, but at some point I hope we can we're working to build out a student program and just continue to see that grow to the point where I hope they hire a student full time, and that I can still stay on and oversee things a bit, but still work in my private practice with my wife too. So the health center, if it's something that you're interested in, you can find out more information online at a lot of different places. There are a lot of different forums, but the model at the community health center in Connecticut, there are several great chiropractors who work there, and they've really been a model for how to build this out. But healthcare is local, so you have to figure out all the nuances for your location, for your state, to make it work. So it's just a great model. I love seeing patients there. There's a lot of challenges behind the scenes, but it's not the same as your private practice. But it's a great place to work for sure.
I commend you on taking action and really pushing the ball forward, because that's what it takes. And you described something there I want to make sure docs listen for. And as somebody who's also practiced in a few multidisciplinary clinics, the understanding that there needs to be a financially viable component to it. You described the E&M coding. When I was practicing at the orthopedic group, I was in a satellite practice that allowed physician-billed physical therapy services if I was present, because none of the other doctors were present. There has to be that component to it that I feel like many chiropractors are either unaware of or might be a little bit aloof to. And it's a critical part of it. And it doesn't overtake the fact that it's the right thing to do or supersede it, but it's nice when it works together, and you can't ignore it, or else you might hit some roadblocks along the way. So that's a great point. I really appreciate you sharing that. And from the inside, what would be primarily the patient flow at a community health center? If a patient comes in, are they first seeing you? Are they being triaged? How does the decision-making process go, and what does the patient flow look like?
The patient decision-making, as far as the flow goes for patients, typically it's going to go through primary care, and that's commonly the way they operate it. That pathway and other settings like VA, at least locally, I know our VA does that. But we're working on a care pathway. I'm trying to implement some of these decision-making tools for our primary care. They're inundated with all different alerts and problems that they have to solve all day long. So try to, again, if you come to the table solving other people's problems first, it's amazing how quickly you'll find you get what you're hoping for in the end anyway. So we have to design a care pathway that suits our primary care, our patient flow. And then the biggest benefit to being integrated like this is that you're set up on the same electronic medical record. In our case, we use Epic. And if your listeners, if you've never seen what it can do just from a communication platform standpoint, the note-taking stuff is fine. Being able to see your patient's full clinical record, being able to see every image that's probably ever been taken of them, and then being able to quickly communicate with the whole care team even remotely. I just got a text message as we just started talking here, Jeff. I had a message on my phone over Epic from one of the primary care providers in our system. And I'm in my private practice. I'm not in clinic with them today, but it just makes that whole process so much easier. So when it comes to the tools at our disposal, that's one of the things that is a significant barrier for our profession as we continue to work in just our private practices. I have kind of another project I've been working on to help solve some of that with our health information exchange in our state, but that's probably another conversation for another day. But those are the sorts of things, just having the tools available and the things that you're developing with Smart Chiropractor, everything that you've done to help put tools in front of chiropractors is essential to being able to further our discussion with the rest of the healthcare team to make sure they know what we do and how we do what we do and the results we get. And it's about communication. So that communication element is something that I really benefit from being in that setting.
Hey, it's Dr. Jason. I just want to take a brief moment and invite you to schedule a demo with our team to learn more about our Patient Pilot automated email campaigns. They are the smartest way to reactivate the people you've seen over the years in the past. Check it out, schedule a demo. We look forward to helping you help more people, piloting your patients back into your practice. Now back to our show.
It's a big deal. There's so much misinformation and just non-information about who we are and what we do. Being able to communicate that in an efficient and at a high level, so critically important. I know we're going to be up against the clock, but I want to get this last question. I know you've been involved in Clinical Compass in the past. You're passionate about research. We discussed it earlier. It's going to be a pretty open-ended question for you here. But what are you most excited about in terms of chiropractic research today or research related to what we do? What gets you pumped up? What are you seeing that gets you excited? I'd love to have your thoughts as somebody who's been on the inside since you first graduated just a couple years ago.
Right, just a few. Time flies. The research side of things, and I've been involved in a few projects where I've shared this notion, is that for 125 years, the chiropractic profession has had a compelling story. And maybe only over the last 10 or 15 years, maybe less than that, we now have the data to support that compelling story. And it comes from the research that's been done, not only in clinical trials, but in the different types of research now that we do with claims data, the different databases that are going to be coming available in the future more and more, I expect, and the amount of people we have dedicated not just to doing research for the chiropractic profession, but the infrastructure to build the tools needed. So we have more opportunities for people. I know when I finished my master's program, as I mentioned, it was sort of like walking to the end of a cliff and then there was an open abyss. And there was no connection to the next step for me. I just had to jump off into a private practice setting that I knew would help me improve the skills that I'd had become somewhat dormant during my time there because I wasn't treating patients full time. So the next phase, I hope, will be, and I'm seeing that now, is that we connect the students to research programs if they want to pursue research full time for their career. We can connect clinicians to better research opportunities if they want to get back into research, and that's something I'm looking at in our health center. And I have access to data now in the health center that I would never have access to elsewhere. So trying to leverage that as an advantage for moving from just clinical practice to taking the concepts of clinical practice, the expertise of clinical practice, and using that with data to answer some really important clinical questions. And, right now, my role in Clinical Compass, I serve currently as the secretary for that organization, and there are some wonderful people on the scientific commission. There's some great people on that board who work really hard to make sure that the chiropractic profession is well represented when it comes to the guidelines and well educated when it comes to clinical practice guidelines. So we're in the process of publishing a update to a recent low back pain guideline. So look for that in the coming months as that process evolves. But go to Clinical Compass and you'll find some of our recent work on chronic pain and neck pain and some other things that, and we not only do we produce clinical practice guidelines or best practice documents, we actually use a best practice document in that pediatric issue that we faced here in North Dakota a couple years ago. But just having that as a framework to point to when it comes to an example for how chiropractors approach care. And when you have conversations with people, especially insurers, they're going to use some kind of guideline. So if you come to the table and promote the guideline that chiropractors have been working diligently on, then hopefully that puts you in a better situation moving forward. So Clinical Compass is a great organization. It's one of the most fun boards that I work on because everyone comes to the table ready to work and really move the profession forward in ways that it's challenging to see how we'd be able to do that in a different setting. But yeah, Clinical Compass is a great organization. If you're interested in research, let us know because we can always use more people to get involved. And it's there really isn't any sort of requirement to just participate in some way or join a conversation or see what we do and see how you might contribute.
I would encourage everybody listening and or watching. We're going to drop those links down below. So if you'd like to get involved, please check it out. If you're unfamiliar, please check it out. It is all about taking action. It's what started our profession. It's what keeps us going. Kris, you're a great example of somebody who has taken action, continues to take action. And on that note, I know you have a patient coming up as well. So thank you so much for taking some of your time today, sharing a little bit of your history, as well as hopefully inspiring some docs to take action locally in their community. When all of us start doing that, our profession and our communities are only going to be better for it. So thank you so much for taking some time today. It's been great to catch up with you.
Thanks a lot, Jeff. I appreciate it.
Thank you so much for watching this video on The Smart Chiropractor. To not miss a single thing that's clinically oriented, marketing oriented, or more, be sure to subscribe to our YouTube channel today.